I'm Megan Ballard, and I'm in the Nursing 2 class of fall 2018, and I will be discussing pancreatitis.
I will be discussing pancreatitis, which is a inflammatory condition of the pancreas. So the pancreas is an organ that sits just behind your stomach, and it helps make enzymes that help digest our food. And it also produces hormones that help regulate the way that our body uses glucose. And just like anything else in our body, it can become inflamed, which is known as pancreatitis. And pancreatitis can be acute or chronic. And when it's acute, it usually appears suddenly, and it can last for several days. And when it's chronic, it usually occurs over many, many years. The degree of inflammation can range from mild edema to hemorrhagic necrosis. So, what causes pancreatitis? It's really not known what causes it, other than it has been related to some things like heavy alcohol consumption, gallstones, any trauma or severe injury like a car wreck or gunshot wound, or just any blunt force trauma. It's also been related to smoking, cystic fibrosis, drug use, damage to the biliary tract in general, or if there is a family history of pancreatitis. So, for pancreatitis to happen, usually the enzymes get blocked by something where they cannot flow through the pancreatic ducts to the small intestines to help break down the food. So when they're blocked, and usually they're blocked by a stone, swelling, some scar tissue. But when that happens, the enzymes just build up and increase the pressure within the pancreatic duct. And when acute pancreatitis is left untreated, or it's not treated correctly, it can lead to pancreatic necrosis. And what happens there is that the duct keeps building up pressure, and it finally ruptures. And it releases enzymes that begin digesting the pancreas itself and killing its own tissues. So once this happens, your pancreas begins to die, and that dead tissue can become infected, which can lead to even more life-threatening complications. Normally, severe abdominal pain is presented. It's usually located in your left upper quadrant, and it often radiates to the patient's back. And sometimes it can even be relieved by the patient leaning forward and taking that stomach weight off of the pancreas. Jaundice can often be noted if that bile duct had been obstructed. During your assessment, pain is usually the most common symptom that is associated with pancreatitis. It may be gradual, sudden, or just very severe pain. Usually it's increased by eating or lying down, because these both put more pressure onto the pancreas. And patients will often complain of nausea, fatigue, and they usually become just very restless because laying down increases their pain. Often a low-grade temperature can come up, along with low blood pressure, vomiting, and jaundice. The abdomen can be distended, and bowel sounds may be decreased or absent, which can lead to paralysis of the bowel, and this is a very serious complication as well. And to diagnose pancreatitis, whether it's acute or chronic, it is done by radiologic studies, like an abdominal CT or an ultrasound of the pancreas. And endoscopy may be done, and a lab analysis of the actual pancreatic enzymes in the blood and the enzymes in the urine. When pancreatitis occurs, amylase and lipase, which are the pancreatic enzymes that help digest our food, with pancreatitis, they are normally 3 times above normal. Amylase levels themselves are not a specific indicator of pancreatitis because they can also be elevated and associated with other health conditions. But an elevated lipase level is more specific in diagnosing pancreatitis. So, how do we help pancreatitis? Well, the patient normally becomes NPO so that the pancreas isn't stimulated to release its digesting enzymes, so that they don't continue to build up and block those ducts more than they already have. IV fluids are administered, and an NG tube is inserted to decrease the pancreatic stimulation, and it helps prevent nausea and vomiting and decrease abdominal distension. Pain medications are also ordered as needed. Anticholinergic medications such as atropine is a real common one that is used because it helps decrease pancreatic activity. But with that, bowel sounds need to be monitored because it's contradicted with the paralytic ileus or bowel that I mentioned earlier. Some healthcare providers go ahead and prescribe antibiotics prophylactically for secondary infections, and this is really helpful when the pancreas goes to die from the enzymes digesting it. Tube feedings are usually started 24 to 48 hours after onset to prevent the release of pancreatic enzymes, and the patient is advanced to clear liquids and then a gradual progress to a more regular diet. But the patient's pain has to be controlled for at least 24 hours before this happens. And if pancreatic necrosis had happened, sometimes surgery is even needed because that dead tissue has to be removed. So, as a nurse, we need to assess the patient's pain using the 0 to 10 pain scale, determine the presence and location of the pain, and if it radiates or if it's relieved by anything. We need to monitor their I&Os and monitor the patient's diet status, make sure they're following that diet that they need to, administer the pain meds as they're prescribed. And normally a patient with pancreatitis is on bed rest with bathroom privileges to decrease the flow of pancreatic enzymes. So we need to assure that they stay in bed unless they are needing to go to the restroom. And we can help comfort the patient by just listening to them and their concerns, and help by repositioning them into positions where maybe their pain is decreased a little bit. Just try and get them comfortable. And we want to monitor that NG tube and make sure that it's working so that their abdomen stays non-distended. And we want to administer their feedings as ordered. So, you also want to educate your patient, and you always want to make sure that they're educated on their specific disease process so that they understand what's going on and how it's treated, and so that they know what to expect. This usually helps calm them down, just so that they feel better in general. And you want to educate them on the medications that they're taking and what signs and symptoms that they should be monitoring for. and teach them to follow that diet that it's prescribed for them. And it's usually one that's low in fat, and it's high in protein and high in carbs, but this is also when they're able to tolerate it too. So the outcome of pancreatitis varies depending on how bad the inflammation is or was, but complications can occur no matter if it was mild, acute, chronic, or severe. But most generally, mild pancreatitis requires less than a week of hospitalization, and only about 5 to 25% have a complicated recovery. Some patients do recover completely, while some do still have recurring attacks of acute pancreatitis. So this is just some general information about pancreatitis. I hope you enjoyed my slideshow. Thank you very much.